Great. Good morning, good afternoon, everyone. Welcome to CGF Health and Wellness Learning Series. I'm Sharon Bly. I'm Director of Health and Wellness here at the Consumer Goods Forum, and thank you very, very much for joining today's webinar, which is focused on employee health and well-being. So on today's webinar, I'm delighted to introduce you to our speaker, Erik Sossa, who's Vice President of Global Benefits and COE at PepsiCo, and who is also the co-chair of the CGF Employee Health and Wellbeing Working Group. And he is also joined by one of his colleagues, Susan Molly, who also works with us on driving our agenda on looking after our own people, the 10 million employees that work across CGF Health and CGF member companies. So thank you very much, Erik and Susan, for being with us on today's webinar. Q&A, very important during the webinar. We want to make sure that you make the best use of our experts' time and expertise, so please do feel free to ask questions throughout today's webinar. You can either send me an email directly on the email you can see here on your screen, s.bly@theconsumergoodsforum.com, or there's a chat box directly on the right-hand side of your screen where you can ask me directly any questions that I can share with the moderators and the speakers. And at the end of the webinar, what I will do, if you have a question, I can unmute the phone lines because you're all muted just for sound quality on today's webinar. So what are we going to cover? I'm going to give you just a 2-minute context setting piece on health and wellness and employee health and wellness here at the CGF. And then I'll hand you over to Erik to bring you through a hands-on practical experience of how they're implementing employee health and well-being at PepsiCo. And as all health and wellness projects, these are journeys, so please do, as I said, make the most of the time with Erik and his colleague Susan today and ask any questions that you may have. So health and wellness here at the CGF, if you don't know us, it's one of the strategic priorities that was fixed by our board of directors, along with environmental sustainability, social sustainability, product safety, and the end-to-end value chain and standards. And health and wellness is one that has been in place when we set our resolutions in 2011, set commitments in 2014, and now we're actually shifting into a new strategic plan in 2018. So you can see here the current framework of what we work on, and employee health and well-being is one of those subjects where we really feel that as an industry we can really collaborate and show leadership on this area. And as I mentioned, there are about 10 million employees working across CGF member companies, so there's absolutely collaborative projects and leadership that we can show in this area. We also work on a number of initiatives under the Collaboration for Healthier Lives umbrella, and we had fundamental areas where we promote knowledge and best practice sharing on responsible marketing to children, product formulation, and consumer product information. So you'll see here on your screen the resolutions and commitments that I mentioned, and the resolutions remain really the foundation for absolutely everything we do in terms of health and wellness at the CGF. And that is, of course, offering consumers and shoppers a range of products and services that support their goals of healthier diets and lifestyles, ensuring we provide them with the right information and transparent fact-based information to help them make those choices, and to use our skill sets in communication and education to raise awareness on health and wellness and really drive the unique capabilities that retailers and manufacturers have at the CGF. Underneath there, you'll see the 4 commitments that we had made on nutrition and product formulation, on employee health and wellness, and they were sunset at the end of 2016. And we still have 2 commitments in place on transparent information and responsible marketing to children until the end of 2018. And employee health and well-being is one of those areas that we're going to bring forward into our new strategic plan, which we'll be working on with the Health and Wellness Steering Committee in 2018. So lots of developments to come in this area, and it's really one where, as I mentioned, we want to really show leadership and move even further with our agenda. So I'll hand you over now to Erik, who can bring us through how PepsiCo is taking this subject and cascading it out across all of their offices and operations around the globe. Erik.
Great, thank you, and welcome everybody. Sharon, you'll turn the pages for me because I'm not trying to do it from here.
Yes, I will. Yeah.
Okay. Great, thank you. So thank you for your time for everyone today. So I'm going to cover a couple of different areas. So there's really three sort of areas of information I wanted to share with you. First, I wanted to share a little bit of PepsiCo's journey in the well-being space, particularly our movement from wellness, which was very, very U.S.-centric, to well-being, and give you a flavor of how we made that transition. And then just share a little bit of our well-being programs and some of the information and how we go through it, and then how we share and how we communicate and engage with our frontline. And then the last piece, which we're really excited about sharing, is our first version of trying to calculate and assess an ROI, or a value, on the wellness programs within the business context. I will caution you, it is our first shot at it. It's kind of our first area of it, but it's an exciting first step at really trying to quantify where wellness has impact and how it impacts not only the benefits area, but also the overall business. So I'll start with what you see here. We've been fortunate in that wellness, and I think this is very true with a lot of organizations, that if your leader and your senior leaders are very much committed to wellness and sort of see that as a personal interest, it does make the wellness and implementing the wellness programs easier within your organization. And that's very, very, very true of PepsiCo as well. You see a couple of quotes here. One that's interesting, one is actually founder of PepsiCo, from Don Kendall, who made this statement probably 40 years ago. Very insightful, very visionary, and understanding the appreciation of how wellness impacts on the business. But that has been carried forward with our current CEO, who's really been focused not only performance, but also performance with purpose. And you see how it will impact how future lives. And then even with our wellness strategy in terms of those families in the old era. The important for us is this is also ties very much with our overall business. We are moving from traditionally consumer goods and salty snacks and carbonated soft drinks to a much healthier portfolio. So there is a nice tie to the business. But not notwithstanding, though, we still need to see the value in the ROI, and we'll go through the next pages. If we turn to the next page. Wonderful. So here's a little bit of a sort of a journey of where we started out with. So we've been fortunate in sort of our leadership has had the ability to allow us to start to develop some of our well-being programs and wellness programs. But a lot of the genesis really was within the United States, where PepsiCo was born, and which might not be surprising. But as we started to look at sort of the value and the real traction we had in the U.S., we really wanted to do a couple things. One, make it much more global. Wellness sounds like a very U.S. term, doesn't really apply globally, but it also didn't capture some of the real things that we want to do culturally. Wellness really refers to really the absence of disease in a very, very clinical area. And we really wanted to see wellness and well-being at a much more holistic level, capturing not just the clinical areas of it, but all the other components of wellness and how they really go through, as you start to see a lot of the literature that really highlight the indicating of social well-being, of financial wellness, and all of those things, how they contribute to the overall wellness. So a couple of years ago, with a lot of the work Susan, who's on the call, and Rich with me as well, worked through and really recast our entire wellness program to a global well-being program. And you see the evolution on the little bottom of the visual. We moved from 4 pillars to 3 pillars, just for really ease of simplicity, but also to bring it to a higher level. And you can see how the things even changed. Eating healthy, get moving, to a little bit more clinical, to a much more holistic, be well, find balance, and get involved. The other advent and the other involvement was bringing in the social context of wellness, which is an important area. As we go through some of the programs we share through, that's become also a good enabler and engagement component. You can turn to the next slide. Okay, so here's where we are today, and you can see we've sort of blown out a little bit of the 3 big pillars. And you can see, I think lots of companies have all sorts of different versions where they have 3, 4, or 5 pillars. But if you look at all of them, they all seem to capture a lot of the same areas, and hopefully you'll see some that resonate with your company that's on your wellness journey. But you can see all of the components that we talked about: physical activity, even components of safety. We partner very closely with our safety program about being safety at work, home, and play, and seeing that as part of the overall wellness mission. All the things we do for clinics. If you look over to the Find Balance, we've also piloted moving some things along financial wellness and moving that as a key part of our wellness program, as well as stress and mental resilience, and also understanding that we are living in a very vastly changing world, and making sure we help our employees and managers, and particularly recognize and adapt on how that change, both for them as well as the employees that they manage. And getting involved, and you see here some of the other aspects, both on the social commitment, both within our organization. We have a very robust, healthy living champions, which really at each locations help promote those programs, but also connecting our wellness programs with philanthropy. One of our wellness programs, we do partner with our foundation to convert our physical activity to steps to money that actually gets donated for food for needy children. So we've tried to capture that social aspect in lots of different areas, both within us, but also outside, and connect us not only with our employees and their families, but also with the communities we work in. Go to the next page. Okay, so here's a little bit of sample of a lot of the different programs we do. One of the learnings we've had with wellness is you do always need to keep them fresh and keep them very, very relevant to the location, both whether it's a country location, but also the physical location. So you see lots of different areas that we sort of keep it fresh. We do the Healthy Living Games, the Ready, Step, Move, Give program, which is a physical activities one we added to this year is the Give component. You'll see some of the other components that we leverage in our corporate locations, like stair wellness. How do you turn your staircases into a wellness activity? So we have a program that works around that. And as we enter the holidays, of course, we have our Maintain, Don't Gain. So that's one of our biggest challenges as we enter the holiday season, is to try to stay healthy. And you can see just some of the different logos and the different programs that we run through. Go next page. Okay. And here just a little bit of highlight of the cafe series. So a lot of the items you look on the first page are a lot of the physical activities. We also try to keep some of the topics and some of the awareness very, very relevant. And on a monthly basis, we do a wellness cafe. We used to do a lunch and learn, but since we don't pay for lunch anymore, we made it a cafe series. But also allows it to be a lot of, again, similar to be more of a global area. It can be either a lunch, it could be a breakfast, it could whoever he is. But we try to touch a lot of the different areas, all the different things that relevant to whatever going on in either the temperature, the time of the year, and going through and promoting all the different components. And you can see them all on the page here. I won't drain the whole area. The other piece I'll also highlight is we do have a number of on-site wellness centers, and that's the employee health and wellness centers that we partner with the Johns Hopkins, and you see that's the reference up there. They've been a very, very key part of our wellness area, both for the clinical aspects, but also we think of them as kind of our front store for a lot of the wellness programs. So they do a lot of the engagement. We'll do a lot of these lunch and learn cafes. Go to the next page. Okay. So as we started to go through within our internal organization and look at expanding outside the U.S., one of the clear things we recognize is depending on if you're a company like PepsiCo or even a company that's just in one or two different countries, typically not every country is going to be at the same place of where you're going to be in terms of wellness. Some may be starting out, some may be doing it for many, many years. But what we sought to do is how do we elevate the wellness and the well-being activities globally for PepsiCo? And what we developed was a global wellness certification. It sounds a little bit ominous, but it's not. It's really just an ability to assess where our countries are in their wellness and help them advance to the next level. So it gives a country who's just starting out on wellness the ability to get started. Here are some of the things you can do on the side, and then our ability to give them aspirational goals. So if you're just starting out, how do you get to the next step? If you're a country that's been doing wellness for 5 years, that's great. We want to provide that recognition, but also the ability to move it forward. And as PepsiCo has always been set in measuring things, we've actually added goals for us internally. So we are looking to have 50% of our countries at or kind of the highest levels of wellness and are advanced or cutting edge by 2025. And the good news is we are well on our way for that. Hopefully we'll have to raise the bar for us internally. But it really is, and we'll share a little bit of what this looks like, but it's really valuable for us to really get the entire planet in terms of the PepsiCo planet moving towards wellness, but also recognizing where you are. So if you're just starting out or anyway, so it's been a real valuable tool for us. Turn to the next page. Okay. And there's a lot of content on this page. I clearly won't go through all of it, but this is that framework. And you can see what it allows us to do. It gives other countries a little bit of understanding what it means to be in the basic area. And we cover all the areas. What are the content, where the audiences, the frequency, the funding, and the assessments of the KPIs. So we give them a little bit of flavor of what it takes to be in those areas, but also give them a look of what it takes to move them forward. How do you get from basic to intermediate to advanced and cutting edge? And the real key is if you look through the cutting edge column, the really big significant factors, that's where we try to assess and measuring actual ROIs on wellness. And as we get to some of the future pages, it takes a couple of years to get to cutting edge. And we've also recognized that's probably where you can start measuring ROI. If any of you are aware, depending where you are on this wellness journey, what we have found is if you put in wellness in 1 year and try to measure ROI within the year, it's very, very hard to get that. It really needs some time to take hold and really take time to see some value back. So where we are now is we typically will measure ROI just in countries that are at that cutting edge stage. Move on to the next page. Okay, and here's a little bit of how we sort of measure the value, and that's a point I was making on the earlier page. What we've recognized and what I've seen and read lots of both supporters of wellness and also critiques of wellness programs in a lot of the media and a lot of studies that have been done. And most of the ones that I've seen have had challenges are typically when you're trying to measure wellness almost instantaneously. And what we've learned, and having the fortune of being able to do wellness for a number of years, or well-being for a number of years, is to understand that it takes some time to really get traction, and that your first years, a lot of the metrics you're looking for are really establishing baselines. You know, as you put the programs in, establishing where you want to see impact, and you could see some of the things that we measure. At years 1 and years 2 and 3, you're starting to measure some participation in the programs, and those are all very good metrics to measure, but really they're primarily focused around understanding if you know your baseline, understanding where you're trying to gain participation and traction. But the real value or ROI really doesn't come to, at least what we've seen, in year 4 or 5. Without having a baseline of where you are, without having activities and giving them time to take hold and see if you have impact, it really takes 4 to 5 years before we're starting to see some ROI in wellness, well-being. And where we've seen is really 2 areas, and this is one of the other challenges you look through when you look through. Some of it is what we would call sort of direct savings. If you're able to reverse health risks, we've seen some literature that really published the value of reversing some health risks really contribute. But actually the bigger ROI, and unfortunately sometimes the harder one to measure, is really the cost avoidance, and the extent and how valuable you can be in preventing and delaying the onset of some of the health risks. And a lot of the independent studies we've seen by the World Health Organization does prove out that the old adage of a ounce of prevention is worth a pound of cure does pay out. One of the studies we did find that the actual value in preventing an onset of a health risk is twice as more valuable as trying to reduce one. So it really is very true, and it's one of the areas we follow from there. But all of the ROI we've tried to measure when going forward, at least in this first version, was really in those 2 areas. Are we able to really address the folks that are dealing with chronic conditions and try to get them to manage those risks better? And those are some of the risks you might expect in terms of diabetes, asthma, the musculoskeletal risks. Can we help folks cope with those areas? But also, can we keep the folks who are relatively healthy and keep them from gaining risk, using those biometric screenings to be early indicators of issues and keep them on the healthy side? You can go to the next page. Okay. Now here's what we did for our measure. There's a lot of data on here, and I won't clear it as well. But what we tried to do for the first ROI, and I keep calling this our ROI 1.0, because it's one of the big challenges in doing a lot of these areas, trying to get data broadly, particularly outside of the U.S. or even within the U.S., just to try to get the data, trying to match up the people versus the actions to get an ROI. So what we've done for this study was really also trying to focus on outcomes. So what we did with this work here was taking a look at where our countries are doing wellness or well-being and been in that cutting edge stage for a number of years, and seeing if we can see evidence of value. So a lot of the independent studies we went through and did the research on showed well-being value in all the things you would expect, both in medical costs, but also we would suspect it would have impact on absenteeism, disability rates, and things that are still health related, but start to touch upon and really start to impact business outcomes. So what we did for our area, we took the countries that we did a lot of study where we could get data and looked at the information that we had done for activity we'd done and compared our outcomes, compared our benchmarks with industry benchmarks in those countries in the areas we could get data, and to see if there was a correlation at least of our well-being programs and positive relative correlations to where we are in those countries. And the good news is, for the most part, in all but one, we actually did see very good positive correlations, and that's on the next page. And I'm showing these directional here. We actually do have values that we have internally, but given the challenge of getting that data together, I didn't want anyone to sort of falsely take those numbers and think you're going to get a 3 or 4 to 1 ROI. I don't think the numbers and the information, the data we have, were that accurate. But the real value for us and what we did, as I stated earlier, what we did is we looked at our results versus our competitors and looked for cost versus the cost of the programs. And these are the countries where kind of our cutting edge countries, the US, Mexico, Australia, New Zealand, South Africa. And we looked across where we could put data and looked at how our results worked with some of the benchmarks. And the real valuable for us here, was really encouraging for us, as you can see, we saw positive and good correlations of positive ROIs in pretty much all of the areas, except for the one, the US LTD cost, which we're still getting some more data on. But the real value for us is pretty much everywhere where we were doing wellness programs, our results were better than benchmarks. We also tested this internally with some of our own internal renewal programs. We have a captive where we self-insure a lot of our programs outside the U.S. And we also looked at how our internal renewal rates compared with benchmarks for those countries that are in our captive where we have the data and are doing wellness versus countries that are in a captive, we have the data that weren't doing well-being programs. And we also saw the similar type results there, that in the countries where we were doing well-being programs and had very robust participation, we were seeing much lower renewals on the medical and life insurance rates, renewals. So again, everywhere that we looked internally, we saw a great correlation. This is a very enlightening, encouraging for us, but I would also caution that we still have a lot more work to do. Looking at benchmarks are always hard because you also need to adjust for other things like age and demographics, and we did some of that where we could, but by all means it wasn't perfect. But the real value for us, again, comes back to there were so many places where the ROI was correlated positively. It was very encouraging for us to both continue our well-being programs, but more importantly, refine this analysis as we go forward. Okay. You could turn to the next page. I think this is So here's kind of where we are. I think we've done a number of different areas. We're looking at kind of the area going through in some of the programs. We continue to sort of oscillate both between our internal data, but also looking externally for ensuring to give us what we really describe as the roadmap to look for where you might see the wellness, well-being impacts. Some of them are in the obvious areas you would expect to see, but we also want to assess if we can see external studies that show good absenteeism for well-being. That also points to us that we should start to hunt those things. So we'll continue to do those areas. We'll also continue to look at sort of both effectively. Is it the program? Is it the vendor? Continue to refine the programs. How do we drive the engagement? If we're seeing countries that might have good programs but low engagement, continue to push those forward. But really, as we go forward in the ROI area, for us, it's all about capturing more and more data and building onto this database. So this was a great first step of that the database, but really knowing we're going to have to continue to build on this and sort of build a long-term case for well-being. On the right-hand side of the page is the information I alluded to earlier about our renewal within our own captive programs. And you can see how really good the correlation where is the companies that do cutting edge, so our countries within our captive had a much lower increase in their medical and our expense to the benchmarks than countries that were just starting out. So this was another point that was very, very encouraging for us. And on next page, I think it's just there's a number of things. We had some other studies we've done in the U.S. side, but I'll pause there, and I think we'll stop there and open it up for questions. In the appendix, I don't know if you were sharing the whole deck, there's some other studies that we've done internally particularly within our U.S. population where we've had long, valuable data, and we did also see true valuable ROI within our well-being programs, particularly on the ones that address clinical risks. So, again, for everything that we've done, we've been encouraged that well-being is working for us, both as a business, also as an employee, but also what we're really encouraged by, it is beyond just sort of the benefits area. We do look at it beyond just medical and prescription drug spend, but also looking at the things that truly impact the business, disability rates, absenteeism. Our next step is if we can really correlate some of these to actual productivity measures, sales areas, some of those delivery areas, and really start to see some of that correlation really take hold and show up in the business aspects. So, okay. We'll pause there and open it up for questions.
Super. Thank you so much, Erik, for taking us through that. Loads of great information there, and I'm sure if there are questions now or something that comes to you at another time, please do reach out to me and I can connect you with Erik or Susan. So do we have questions on today's webinar? You can either send me an email. My email address is here on the screen, or use the chat box at the right-hand side of the screen. I'll just pause for a moment to receive those questions. So Erik, I'll kick off with the first one I've received. What are the next steps for PepsiCo in terms of ROI?
Yes, that's a great question, and the one that we are constantly looking for. One is really building upon both the collecting the data. The other area we're also trying to partner with are some external folks that could help, what I call, I have an actuarial background, but really normalize some of that data. One of the challenges when you just compare your results with sort of industry benchmarks, there's a lot of other variables. If your population is particularly younger than maybe the benchmark, that might cloud some of the results. So the next area is getting some of the better data and also being able to normalize some of that to the extent we can. As we build some of the longer databases, what we are hoping to do is similar to some of the other ROIs that we've been able to do internally, where we've had long longitudinal data and long participation, where we can actually do matched employee studies, which is really the value that we've done in some of the other areas, where we can match our employees that of similar age, similar geographies, similar medical acuity conditions, and then assess those that participate in the well-being programs, compare those that are participating versus those that are not, and seeing if we can see the ROI in those spaces as well. So that's a much more sophisticated type of an ROI, but takes a lot more data to build for. And also looking externally for also helping us, pointing us where we would look more for well-being programs. The real value for us is, and one of the things that we've talked to about, is really being able to take the ROI or the value of well-being to be more than just your HR or your benefits imperative, to make it a true business imperative. So if we can start to see and demonstrate those measurements and all those other metrics, productivity, absenteeism, presenteeism, that will really be able to really give us the ability to continue to push. And we've been very successful in our areas, but really being able to truly embed this and imbue this in the overall culture.
Great, thank you, Erik. Next question. So thank you for the excellent presentation. Which of your programs do you think have the highest value?
Ooh, so this will be hard to say. I think you'll see, and I will do this more in terms of time value. We've seen, and I'll open up to Susan because she may have a point of view, but when we look at a very broad definition of all our wellness programs, those that address people dealing with chronic conditions will have your probably most immediate ROI impact. So if someone, and that's pretty intuitive, if you have someone that's got a health risk that they're dealing with or not managing it properly, you will see some instantaneous ROI value. If you can help a diabetic deal with, manage their A1Cs, if you can help an asthmatic manage that, you can see the value there. However, though, those are the longer term ones. Ounce of prevention is truly worth a pound of cure. I think there's a lot more value that we just haven't fully assessed in some of the programs and activities and physical activities. Susan, I would ask you to you run these programs.
Yeah, so I would say our biometric screening for a multitude of reasons. First, I think they create these educational moments for our employees. We do over 500 events in the U.S. alone, where we have a vendor come on site, and we use it as an educational opportunity because I think for many of us, we're in denial about our health and some of the key metrics of our health. And so when you're sitting in front of someone with those actual results, and again, keep in mind our employee population is predominantly male and doesn't often go to the doctor as some of as men typically don't go to the doctor as much as women. And so in addition to the teachable moment, those events have also created aha moments for folks, not realizing their results, but we've also had a significant amount of folks have immediate referrals because they have either a chronic condition or something that needs to be addressed immediately. So that would be my input.
Great, thank you. The next question I've received is, what would you recommend for a smaller company where to get started on the well-being journey?
You want to?
No, go ahead.
Yeah.
I'm opining.
You're finding it. Yeah, it is always sort of feels daunting when you sort of look at what large companies have been able to do on the wellness space. But I think there are some pretty low-cost things that you can do.
Yeah.
Come through. Simple things is a lot of the communication is a wealth of knowledge available publicly to go through that you can pull for areas, tying them to any sort of events. We do hydration during the summer, so that starts to be able to give a sense of. But any sort of giveaway. The other area we've been able to, particularly if you're global, and if you have an EAP program in any country, that's been a very good enabler for us on some of the well-being front. A lot of the issues a lot of the services you can get both in the physical wellness as well as financial wellness are part of your standard EAP package. So if you have an EAP vendor, I would look to them to leverage their capabilities. We've had a lot of success at very, very limited cost areas. The other areas, simple events, walking challenges have done really effectively for us too, to sort of bring some of that social area. And our AMENA sector, for example, has not had a lot of money to spend on wellness, but has become a very big part of that culture through simple competitions and sports events. Yeah, so our culture is such that we're very, very competitive. So what we've been able to find is that for little to no money, you can run a challenge like a walking challenge or other things, comparable things that don't cost a lot of money, but make the folks in the locations competitive and feel good. So Erik briefly mentioned Ready, Set, Move, Give. We partnered with the PepsiCo Foundation for a donation to some charities. So we converted steps to an actual donation. So, even if it's a small amount of money, I think it made people feel good about doing something for others while they were helping themselves. So fundamentally, getting things down to the grassroots level and getting local leaders involved. I think often the business is looking for something positive to do with employees, and I think we've piggybacked on that concept to make wellness the feel-good piece of all of this. And as we know, it's not just feel-good, but it was our way of getting our foot in the door.
Great, thank you. And another point I might add to that is the Health and Wellness Working Group here at the Consumer Goods Forum created a chapter in a toolkit, and you can see the address there on your screen. It's consumergoodsforbetterlives.com, and there's a number of different resources available on that toolkit. So it's another go-to maybe place for some of the smaller, medium-sized companies to get started. And a lot of checklists and questions that you can begin to think about when you want to get this up and running in your company. And Erik and Susan and the rest of the team, I think, are very open to working with more companies on the Employee Health and Wellbeing Working Group. And as I mentioned, we're at a shift in our agenda, and we'll be rolling out a new plan next year, and hopefully showing even more leadership in this space. I think that's everything. I don't see any other questions or hands raised. Okay, Super. Well, thank you so much, everybody, for your time. Erik and Susan, thank you for sharing all your insights. The webinar is recorded, so if you want to share it with a colleague who wasn't able to join, or you think of something you'd like to ask Erik and Susan after the webinar, don't hesitate to send me an email and I'll make sure to connect you up. So thank you very, very much, everybody.
Thank you, everyone. Have a great day and have a great holiday season.
Thank you.
Thank you. Bye.